Good morning, dear student. I see that students join in cabinet. Wait some minutes and start. Okay, I think we start. %, traditionally I see 10% student of your flow in our lecture. Okay, today, sorry, do you see a presentation? Type in chat, please. And we start. Yesterday I sent a message in your portal in AEOS about our testing. We start on Friday at 11. Okay, thank you. We have enough time to I see any we have full time to working until the evening. I think I give you 3-4 hours to come in portal and do a test. We may start after your classes. Yeah, it's not big problem. I understand that it's not classic testing, and I think that main goal of this testing is organized students to working. Yeah, I think you have time to type in chat what's the time when I finish your classes on Russian language. What time when you may start testing. Okay, thank you. You may start in 1 hour PM and you have some hours to working on test. It's normal. Okay. Today we finish our course by this lecture, this topic, research ethics, and each term includes some historic fact about this and some contemporary situation in our medicine. And this part of history of this term we observe, and more detailed speech from trials, medical research, yeah? And what's the ethic component in this progress, in this part of working, yeah? At first, we must remember Nuremberg trials. Yeah, I said about this in my first lecture when we described the 3 groups of reasons of born of bioethics. Yeah. And you see that 20 Nazi physicians come to prison because her experiment was very hard and very dangerous and not humanity, and it's one point why we discuss bioethics in medical university. Yeah? As a result of these trials, yeah, on this process, law process, was be created Nuremberg Code, Nurembergский Codex, Nuremberg Code. Was formulated as a result of dictatorials, yeah, and the World War II, yeah, when Nazi physicians were convinced of more serious broken any human rights in experiment with camp prisoners, yeah, and other you know this from your history classes in school. Yeah. In Japanese war we see the same situation. Yeah, and some postulated in Nuremberg code. Yeah, you see in slide. You may screen. Today I sent you all PDF variant of presentation on your portal. You may see this in concentrate variant. Yeah, all our topic. Yeah, and we at first, yeah, we see that the main riches of our feeling to examine the process of the organism and how it's working, how we may examine this located in the area when we must experimentate with human and human body, human mind, yeah, and we may realize yeah, this principle of voluntariness, yeah, and all methods, all experiment must be documented in ethical research commission. Yeah, the next principle, it's goals of this research, yeah, and it's must be good result from society, yeah, sustain the growth of medical knowledge, yeah, and it's not be unnecessary in nature, yeah, some topic of experiment, yeah, the goal of experiment at first, yeah, what we find in the result of this experiment, yeah. Yeah, next point, it's realized in our clinical research phase, yeah. All experiment at first start on the result of animal experimentation, yeah? And on this step, after this step, we come to experimentation with people, yeah. Yeah, you see it's a four principle about suffering and injury, mental and physical health of the experiment who we come. Yeah. The next point of Nuremberg Code, this yeah, we may think about the reason of some death or disability in the future with these people, yeah, and it's a field of working by experimentation by physician, not by experiment data, yeah. And we must increase the our experimentation to decrease the risk in this experimentation, and it's main our problem in this ethical problem, yeah. Yeah, and the seven principle, yeah. Preparation should be made and adequate facilities in a first step, yeah, and it's maybe detailly preparation until we start the experiment. Yeah? And it when we observe term of clinical research in contemporary situation, we realized only this principle of Nuremberg Code. Yeah. Yeah. The eighth principle, it's main if some of us may be interested in some research, in some experiment, and I remember my study in university, and I remember feeling to touch some interesting term in some fields of medicine, and we come to a national кружок, I don't know, yeah, in English, scientific group of experimentation, some, and we work on this, and in 8 point you see that it's a field, it's a hobby, it may be hobby in our university. Yeah, we have a few subjects in our university who may do some great experiment in medicine, yeah, great trials, including this, because it's very serious, hardworking. All experimentator must it's a term of our clinical trials. I tell about this, yeah. And in 8 point you see that it's a very qualified person in scientific fields, maybe include and start some experiment in medicine, yeah. And in public process we see the journal watch to this point, yeah. In the process of the experiment, we should be liberty to experiment, and in our clinical trials we see about the end point and intermediate point in experiment. We see on this and realize principle of liberty and wholeness of our subject. Yeah? And then principle, yeah, you see, we must stop the experiment if we see some side effects, some dangers in our result, yeah, in the intermediate point of experiment. Yeah. You see a short variant of this 10th point. Yeah. It's important. It's some main principle of Nuremberg Code. Informed consent, yeah, voluntariness, yeah, focused on the result. Yeah. At first, we start with animal experimentation. We minimized any mental suffering and injury in our experiment. Yeah. We must think about some disability injury in our experiment. Our risk should be minimized. Waste by the potential benefit of the result of this experiment. 6 point, yeah, you see it. Detailed preparation until we start the experiment. Only very high graduate scientific index researcher in this field, yeah. All subject has a right to end experiment in any time, yeah. And scientists must be prepared to end experiment if subject at risk. Yeah, I tell about the cases on this point. Yeah. The next, Belmont report. Yeah. I tell about syphilis Tuskegee experiment, yeah, in United States. You remember this, and on the material of this problem on this experiment in USA was be created Belmont report in 1979. Yeah, by the National Commission of the Protection of Human Subject in biomedical research, yeah, in Belmont, yeah, it was created. Some postulated in the field of experiment. Yeah, you see this in slide, yeah. And it's known by you, some bioetic principle, yeah, created in this time, yeah, respect from persons, yeah, and respect for human life. It's a main principle in bioethics, yeah, and you see the same definition in Hippocratic Oath in previous lectures, yes. Beneficency and justice, it's a principle we tell about this, yeah. Autonomy, yeah, principle of about no some pressure or coercion in experiment, and I may include this, yeah, experiment in Nuremberg Code. It's interested experiment, but I don't have a prepare a slide of this. Yeah, in our mental experiment in another term of our practice. Yeah, in psychiatric problem of experimentation in medicine. Yeah. It's our step after the World War II in Germany. Yeah, this nationality think about this step of her history, about this Nazi flow in society, yeah, about human race. Yeah. You may read about this. Yeah, it's experiment with a subject on a Nazi experiment. Yeah, and about not pressure or coercion, because the experimentator has a big power of her subject. Yeah. The next principle, beneficency. Yeah, you see definition. Essentially, the well-being of study participants. It's our goal. Yeah, minimized any possible harm and maximize our benefit of this experiment. Yeah, you see the same from definition on previous slide. Yeah, and this principle of justice. Yeah, all our site of experiment must be shown by the experimentator and from a bank document in a little shrift, some aspect. No, all site of experiment must be shown from the all experimentators who take part in this experimentation. Okay, and from this part we start the exam, the problem of clinical trials. Please pay attention to this term because it's a first touch from the contemporary scientific approach in her introduction in medicine, because in last 15-10 years in medicine the main principle it's medicine based of evidence. All what we describe, all what we recommended, all our treatment, all our manipulation must be based on the clinical evidence, clinical trials. It's a good field to see. Okay, and on the base on these trials we created any guidelines from a problem. And if you search the problem of COVID, we may feel the interest from World Health Organization, when we wait a new update on this document, on these guidelines, where we look the main achievement to treat this infection. What we must do, and I see any discussing how we must treat it. In the animation we must lay on a bed or abdominal our patient to ventilation. It's a acute problem in a start of new diseases, new infection. Dear students, I want to tell something from our organization. I see previous time I see many messages in my WhatsApp. You may search my telephone number and send me a message. Please, all information I sent you in your lecture and in AEOS portal. And who have some problem at first, please open your cabinet in AEOS and see information of this. I update some information in portal, and be attentively our session start on I remember it's from 7 on February, and we must finish 2 course of medical history and bioethics until this time. After this I send all document in decanate, and we students who doesn't come to a test and working, in future I visual this problem. It's the same problem from all years, when students write me 1,000 message in WhatsApp. It's not normal. Look information. I have many students in your flow 300 students. In my traditional 5 course I have students. In my traditional 3rd course I have a 10 group, plus 300 students, and if all students send me a message in WhatsApp, I block these students who do this, okay. Clinical trials. All our treatments must be laid on this research, on these clinical trials. And today we have a good working machine on producing of this material. At first we start to examine 4 phase. We maybe divide 3 phase on 2. In my slide it's 4 phase, 4 step on clinical trials. You see it in slide. At first, you remember that the pre-phase of clinical trials, we name this if we start the experiment from people. And until this, we must create some molecule in laboratory, in chemical laboratory. After this molecule start the experiment in a tissues, experimentations, for example, in some chemical laboratory. After this, we have experiment on animals, in small group, in demonstration of some variant of diseases from animal, and we work how this molecule doing in the normal function, or artificial function from diseases. And after this we start the first phase. You see there's a number of participants, it's a very small group, it's pilot research, it's named пилотное исследование, pilot research, 20 or 80 group, and it's people without any problem with health, without diseases. You see this in slide. It's the main goal on this. We must see how this chemical structure doing in the normal human body, and identify some side effect of this chemical structure. And we not need any control group. And you see the main big problem from motivation, financial motivation to invite in this experiment, from these participants. And it's a voluntariness process by we have any financial motivation in this step. If everything normal, if we come this step and see that it's normal people and this molecular work good and we doesn't see any side effect, we start the next phase of our experiment. And the group may be larger, 1, 2, 3 100 participants, yeah. And the goal of this phase, yeah, look to problem more larger, yeah, and identify some effect of therapy, yeah, some effect of therapy, and any potential benefits on our treatment of our molecule. Yeah? In this step, we doesn't have any control group because we focused on a benefit on this therapy. Yeah? And the three phase of clinical trials may be divided in two parts, and commonly you see that until we this phase start in the large group of people. It's a count of 1,000, 1, 2, 3,000. For example, framing game clinical trials include 18,000 people. Yeah, all people who live in city Framingham include in these trials. Yeah, it's a first, historic first big medical trials, and we demonstrate the risk factors of cardiovascular disease in these trials, and we understand that the main role of cardiovascular diseases. Yeah, and today it's gold standard of trials in this field. Yeah, it's a huge group, yeah, of people, and we observe a treatment and a medical problem. Yeah, we must diagnose this, and very clear diagnosis, one medical problem, one disease. Yeah, and in this step we have a standard to include standard of this experiment and delayed standard on experiment. Yeah, what's the point when we include this person or delayed of the experiment? Yeah, and the another problem of this, when we stay on diagnosis only on not hard point of diagnosis. Yeah? In medicine, it frequently we, for example, the 10th type of headache. All our mechanism of diagnosis this disease include only clinical interview with patient, and how we must standardize this variant of diagnosis. It's problem, and in our practice we see that it's a problem to start this clinical trials. Yeah? One. The next, you see, we must have a control group in this phase of experiment. Yeah? It named blind or double blind studies. Yeah. Blind, what meant? You may hear this term, double-blind trials. Yeah. I tell something about the process of clinical trials. Yeah. At first, you may know that who is initiated this process. What the main power to start any clinical trials. And you may type in chat your opinion, who is the first who thinking about clinical trials and start any movement from this process. Yeah. Who initiated any clinical research in medicine? What the structure? What's the people? Yeah? Who is it? Please type in chat your opinion, your thinking. I'm interested by these questions. At first course, we start your medical education. What you think about this? Everything of us took some treatments from some diseases. We find a good variant of treatment. We may read something in internet about the approach to treatment and this process. Who initiated any clinical research? Students live outside of the internet. Okay. Interactive variant doesn't work. Okay. What the problem of clinical trials? You see that we may include many cases in this trial. It's only 1, 2, 3,000 of people, and it's maybe clearly identified one diseases, yeah, especially stroke, for example, yeah. And in one hospital, one city, we doesn't find this account of person, yeah, of our hospital, and we must collect any case from different part of a city, different part of a country, and traditionally when we think about treatment from all people from all over the world, we think that one drugs work good from Indian and not good work from China or Russian or in USA. And it's historic fact on this problem, because when we have good clinical trials demonstrate that hypotiazid, it's a drug from arterial blood pressure, yeah, and we start to treat all patients all over the world by this chemical structure and see that the answer of this treatment from black men in USA not good. What happened? And we do all normal. We describe this treatment black and white, men in USA and see that the white men feel good, we have a normal blood pressure, and black men have a problem. We think about this, analyze this, and understand that the renin-angiotensin system in the body of black men work with some special moment, yeah, and this drug not good work in black men and very good work in white men, and in the international clinical trials we must think about international approach and realized of this trials include some specialists and some patients from USA, Europe, Indian, Africa, yeah, Russian, and it named a double-blind international clinical trials. Yeah? And who may collect this big scientific structure? And at first you students may think that it's interested in medicine scientific approach when scientists sit and think how we may treat these diseases. Yeah? We sit on our working place and think about our salary by the work at first. Yeah, it's one of the next they're interested of professional. And you see that one of point of Nuremberg trials, it's a very high graduate of scientific scientists in clinical trials, and these people may have a big salary from her work. Yeah? And who create these trials? At first, it's pharmacological company initiated any clinical trials, and it's very expensive, very expensive deal. It's very big deal. Start and realize clinical trials, and huge institutes work on this and have a sponsor from pharmacological company. And when we think about pharmacological company, we see a good picture. Yeah, we see a commercial structure. Yeah, at the first, it's a benefit from working. Yeah, material benefit. Yeah, it's a structure that the goal of this produce any money machine at first. The second, it's interesting from a human benefit, any new kind of treatment. At the next, at first, if this company stay on this field and continue to work, it may be produced money at first. Yeah? And in this structure, we see not only scientists, it's approach of economic, yeah, marketing, and these people think, these specialists think from another side of any research, and we may think about this. I introduced some information from clinical trials because at first we must know this black side of our working of our medical situation in contemporary world. Yeah? We understand that main powerful on the hand of pharmacological company, and pharmacological companies say doctors what we must describe in our practice. Yeah, and For example, one case, one experimentator in clinical trials work by patient include this any count of participants of a study. It's maybe 1, 5, 10 from one scientist in one city, for example. And salary of this working may be maybe only one salary of teacher in university from one case of clinical trials. It's very expensive work, and this example demonstrated the commercial side of working of this machine. Clinical research. What we understand in double blind. In the center of clinical research in some institute who sponsored by pharmacological company write a protocol of clinical research, and in this protocol we write about control group and a focus group. In control group we see the same people, and they took treatment by the placebo. And at start, pharmacological company produced new drugs and placebo, and nobody know what the drug and where placebo. Doctors, scientists in research examine some parameters of working of body of patient, took the drug and examine the parameters in the long time. It's writing in the protocol of experiment. It's maybe 1 year, 6 months, 3 years, 5 years. It's maybe a longer period, And all materials sent in the main center of experiment, and nobody know where was a drug and where was a placebo. And only in center of clinical research separated this case placebo, this case it's a focus group. It's double blind clinical research. Next point of clinical research. We at first until we start, we must think that the focused point of our research, and it's a main point, the end point of research, and intermediate point of research. It's introduction in a not very long time, because we have some ethic problem in clinical trials, and today we have we doesn't see a control group in clinical trials, and it's working by bioethics. It's one example when the bioethics conformed the system of global medical approach to some problem of clinical trials. What the ethic problem lay on this principle? Look on this. we remember the syphilis Tuskegee experiment. Yeah, we find people with one disease, find two people with this disease, and we start an experiment. Yeah, and give from one we give placebo and observe what happened, and to another we took a treatment and observe how he well-being in this situation. And what's the difference between these two people? Informed consent, yes, it's same, but bioetic problem on this approach is huge, yeah, because we observe how this person working with diseases, yeah, how they live in disease. And in some trials from cardiovascular problem, we see a very, oh, you see a blackboard, I may write something, yeah. Interesting to you, yeah. The line of death in clinical trials, yeah, it's time and it's a count of deaths. And in one case, it's a placebo. One group who took a placebo, and it's a focus group. It's have a treatment, and you see a gap. For example, if we have 3,000 people in this two group, we have maybe 200 deaf people, because we want to know how these new drugs work. And we look how in placebo group, how these people die. And we observe this because we have a big interest in to this problem. Yeah? And in why we include in protocol intermediate point 3 months, 6 months, 9 months. We look on this gap, and analyze its statistically difference or not. And if in this time we have a pay criteria minimum by this count, we must, and it's right in our protocol, in our clinical trials, we must on this time, if we see this statistical point, we must stop this experiment. Because we see that statistically in placebo group we have a more deaths from the focus group. And it's a problem, yeah, it's an ethic problem. And today we have a traditional clinical practice. Yeah, it's named trials by traditional clinical practice. When we doesn't have a placebo group, we have a group first and second, and in focus group we have a traditional treatment plus new drug, and placebo, we have only traditional treatment. And we analyze differences between these two groups. It's a contemporary approach in clinical trials in our practice. Yeah? What important? Yeah. And in test, yeah, dear students, maybe pay attention to this, yeah, to this count. We see this level of statistical level at questions of our test when we analyzed the clinical trials and said that it's statistically right differences between two groups. Yeah? Okay, and fourth phase, it's named post-marketing studies and post-marketing research. Yeah? And after three phase, it's from a different, it's named registration phase. Yeah. After these trials, we pharmacological company sent all material on these trials, on animals trials in previous phase, sent in FDA, in government structure of any countries, and wait a document to registration and start distribution of new drug. Yeah? And after this, we have a fourth phase post-marketing when we observe any side effect, any accumulated risk, any benefit, yeah, of this drug in a real treatment. Yeah? In different countries, this approach work differently. For example, in USA, it's a very strong structure when we declare any side effect of treatment in our practice of doctor. In our country, it's not very hard structure working, yeah, pharmaco observation, yeah, structure in the government, yeah, Rospotrebnadzor, its name in Russian, yeah. We doesn't have any problem with government in our practice and doesn't send any information from side effect on any risks in our practice. Yeah, it's a problem of our field of working. Okay, and commonly we must know 4 stages of clinical trials and stage, pre-phase, 0 phase on animals. Yeah. You see some main goal problem where we demonstrate our medical achievement. You see in slide this some infections, congenital diseases, yeah, some cancer from childhood problem, yeah, some chronic diseases, yeah. Heart and lung disease, it's very acute, very interested. When we start this approach, I touched this moment in my practice when I was a student, and we come to a great conference, scientific conference, and in one time of a year, all great scientists in this field, yeah, demonstrate a new approach of treatment, new information of these diseases. It's a famous time, and when we create this method and used in practice, and all doctors sit in huge conference hall and think that I may treat my patients better because I knew this information. Because I see that my previous approach to treatment may be increased effectively, maybe more better, yeah. And yeah, from animals, yeah. Next, health treatments resulting from biomedical research, yeah. You see some example. It's not only drug, yeah. You see this any medical devices, yeah. Heart defibrillators, for example, yeah. Any stents, any medical pacemakers, shunts, yeah, pacemakers. It's I try to lay on English, yeah. Cardiostimulator, yeah. Cardiostimulator, yeah. Some surgeries approach, yeah. Some transplantation of artificial organ, artificial I see a knee surgery, yeah. Or any vaccine, yeah, it's actual in our medicine. COVID vaccine, yeah. Poliomyelitis is one of great example when we stop the dangerous disease by vaccination, yeah. Some drugs including painkillers, antibiotics, medical from heart blood pressure, yeah, cholesterol. It's a huge achievement in medical practice when we introduce the statin therapy and see degrees of risk of cardiovascular disease from only 6 and 40% degree risk of cardiac attack when we treat by statin and without this therapy. Yeah, it's a great achievement, and I see this phase of our colleagues of cardiology, yeah, when we come from any scientific conference and say about this great achievement, yeah, of this field, yeah. And we separate some principle of clinical research in ethical guidelines, yeah, and in all structure in our universities too we have a commission of bioethics commission, yeah. When we start any experiment in our university, we must have a document from this commission, and we describe all variant of our research. We hypothesized any side effect, any risks, and we describe huge benefits of our research. And it's a good practice from all research center, yeah, in this field, yeah. The one of principle is confidentiality. It's understandably, yeah. Voluntary consent, yeah. Informed voluntary consent, yeah. Especially voluntariness lay on the aspect of any research from people, yeah. Yeah, next Next principle, right to refuse or withdraw at any time. And reporting back. Yeah, it's important principle when we have some data analysis in the intermediate point, and we will see any problem in the future if we continue this experiment. Yeah. And yeah, special consideration from vulnerable groups. I tell about this when we separate from placebo and focus group, and in this analysis we separate from for example, from child and old, young, from the age, yeah, of childhood. We see this experiment in pediatrics, yeah. Man, woman group, yeah, how this treatment work on this black man, white man, yeah, Asian, Europe population group. Yeah, and we divide this group to examination. Yeah. Okay, it's all our material today. Okay, and what the main thinking about this. At first, I hope that you understand that we have some pressure, medicals have some pressure under pharmacological company. It's a first to understanding principle. Because all conference sponsored by pharmacological company and all speeches of all scientific researcher sponsored by pharmacological company. I see information in internet in 20 years only 80% of author of scientific articles doesn't find a salary from pharmacological company. Yeah, it's one point of the article in a famous journal. We demonstrate the sponsor the reason of sponsors of this research. Yeah? It may be grant or it may be sponsor of pharmacological company. Yeah? You understand that only 20% of research, it's a clear research without pressure of pharmacological company. It's important to understanding when we search any approach to treatment, we see only one path, only treatment paid by cash from pharmacological company. And when we have a problem of a baseline medicine, and when we start another methods to treatment, at first we stay on a problem with evidence. And who may evidence communicated skills of a doctor? We have pilot trials in this field, but it's not huge trials when we may say that I must learn by heart this term because it's a result of our treatment in the future. Yeah, any communicative skills, for example. Yeah, or psychotherapy treatment. Only one approach in psychotherapy have a baseline of evidence in USA recommended this, and you know very many difficult different type of psychotherapy. Only one cognitive behavioral therapy, including medicine based of evidence, yeah, in FDA. Yeah, and it discipline created by Aaron Beck, and it's a way from 313 years of working, yeah, in United States. And its example, and we may see the problem why that only you introduce in your practice, in your future medical practice. Yeah. And the next point, I hope you differentiated this, that we have this approach, and we write by blood all these rules. Yeah, it's example of syphilis, Tuskegee. Example of this, it's a Belmont report as a result. World War II with the Belmont report. Yeah. And example from thalidomide tragedy show us that we must be attentively in our practice on methods what we used. Yeah. Okay, and this term is very interesting for me because it's one great example when we realized principle of technical and humanity balance in society. Yeah? Because on technical approach in medicine we have a great achievement, yeah? And you have a case of placebo control, and Atik in the another side balance this approach to a most humanity, and it's working by pressure because you may look on these differences. When we have a placebo, these differences may be 13%, for example. And when doctors see this, and we understand, if I have 100 person from a month with this disease and try to treat by new treatment, I hope that I save 13 lives from 1 year, for example. Yeah. And and it's a huge count. Yeah. And when we stop a placebo trials, and when this group have not tracked, not very high track of death, yeah, we see some kind of 10%. It's not very famous in practice, and it's some problem with marketing, demonstration of the trials. Yeah. Yeah. Okay. Okay. we must finish our lecture. Yeah, we talk more about this. It's interesting term from me, and I think that you're interested in the approach of medicine based of evidence, yeah, and think more clearly when we see some trials in some branch of medicine. Yeah. Okay, I see an organization question in chat. All characteristic of test I type in your portal. Yeah, it's simple questions from our lecture. From one right answer. Yeah, a count of questions may be 25. 20, 25, not bigger, and what the 16%, it's a level of testing. Yeah, one half right answer, it's normally to come to the credit. Yeah, okay. Thank you for attention, dear students. I sent you my presentation in portal. Look on this, and you have a time to prepare my material. Yes, fixed time to test, but it's maybe 2-3 hours. Or, we have enough time to working with tests. It's not be limited by 10 minutes. Yeah, we have normal time to working. Okay, but it's limited in one time. In Friday you may come in portal and working. Yeah. Not exam, it's credit. Yeah, it's a course of credit. We will have a credit. Thank you. In what is the time? In 11 o'clock on Friday, come in AOS and start to work. Some group who have classes in this time start after your classes. You have time to evening to work by test, but it may be sent on Friday. Yeah, I think it's a good approach. Yeah, 5-6 o'clock I have normal time to work. Yeah. Okay, thank you. I see a smile. Good.